now let's come to the interview part. I'm sure you when you are interviewing, it's basically a part judging part.
Yes.
You are getting someone in your family and giving a lot of responsibility, taking yourself responsibility. So what are the things you see when a candidate interview you and you think that this is the candidate we want in our program, other than their score? We already know once it's inside,
Yes.
we know that we want this candidate. Now it's a part of the other part. So
Yes.
would you please elaborate that
Sure.
process so we can understand?
And Zoom interviews or WebEx interviews are very different than in-person interviews. Be sure that when you are doing a Zoom interview, you control your environment. Okay? Make sure your background is nice. Make sure it's clean. It's not disheveled. Make sure you don't have babies crying or a cat jumping across your lap. Make sure you have a nice professional environment
Right,
first.
like you're giving real interview.
Right.
You are like one-to-one.
You don't want me, the listener, the interviewer, to be distracted by what's going on. You want my focus, not the other things.
Right.
So you want to make sure you control that. I also recommend people to put behind them something that you want me to ask you a question on.
Okay.
So whether it be a piece of artwork that you drew, an award you received, a book that you read that showed your interest in healthcare, put something behind you that I say, oh Shazad, what's that? I see a trophy behind you. What is that?
Yeah.
And you say, oh, funny you ask. That's what I got for being top of my class for GI.
Right. That increases the interaction and releases all your tension also. You become like a more one-to-one, person-to-person. You're not like, holding yourself tight. You're thinking, okay, oh, I'm going to get a mistake, I'm going to do a mistake, and then you do the mistake. So those things and, smiling and everything makes a lot of difference in the...
Your body language makes a big difference.
For example?
So if I'm sitting here talking to you, I'm open. If I sit here like this, if I'm looking away, if I'm constantly fidgeting with my hair, that shows something different.
Yeah.
I remember I once interviewed a girl that was constantly playing with her hair. And then when we went to do our rank list, the other person that interviewed her just so happened to say, oh, I know that girl. She kept messing with her hair and wasn't concentrating on the interview.
Yeah, that distracts the interviewer and also shows about you that why you are either you're nervous or you are not confident. So that, those things, those clues make your image. So we don't know about you, right?
Everything is a piece of information.
Right.
How you look, how you dress, the words you choose, the color of glasses you wear, the way you do your hair, every single bit is part of our judgment. Because we're there judging you.
Right.
That is what we're doing.
Right. So when you ask, what are some complex questions you ask to know, see whether this candidate is going to, pass your test?
Well, to me, my first question is the most important. And I always start off interviews, and almost everyone asks this question in some way, and I'll say, tell me about yourself.
Yes.
And I give you a nice, very simple, open-ended question. And now, as an interviewee, it is your responsibility to control it. That is your opportunity to dictate the tone of the interview. Because if I say, tell me about yourself, and you say, hi, I went to medical school, I like internal medicine, I want to match in your program. That's not a very good answer.
Yes.
But if you say, I'm great, I'm so happy to be here, I worked my whole life for this moment, and this is a culmination of my medical education and my training, and I love taking care of patients. I immigrated to this country so I can be part of this healthcare system. I'm so passionate about this, and I hope to show you my best right now. me, as an interviewer, I love that. I'm
Yeah.
excited. I want to ask you more questions.
More questions, yes.
And that's what you want. You really, as an interviewee, control the interview.
So, okay, so what are the red flags? One you told me about, that environment, you make your environment, have something behind you, and, don't be tilting your chair, because anything distract an interviewer is not good for you. So what are other red flags you think you have seen, especially now this is a Zoom era, we're not doing one-to-one.
Right.
Because this is really different. I know some people, they are very good, they're excellent, but they can't control their, screen time anxiety. That is very common. I've seen even the CEOs doing that. So what are the other red flags do you think can be controlled or can be a negative for the interview?
One of the biggest red flags I have, because you are on your computer or your laptop, some people have pre-written answers.
Oh,
I can tell if you're reading. If you are reading something, automatically I'm turned off.
right.
Because I can tell that you don't even trust your own abilities to answer the questions.
Yeah, you're not natural. You're not yourself.
And also the person who is overly rehearsed.
Mm.
So a lot of interviewers ask a lot of the same questions.
Mhm.
Tell me a strength, tell me a weakness, tell me about a patient case, whatever. If I'm asking you question after question, and I can tell that you've practiced that answer word for word for word, I said, maybe this patient can't think outside the box.
Mm.
Now, I personally always ask fun questions.
Right.
Things like, if you were stuck on a deserted island, what drugs would you bring with you? Or what influenced you to get into medicine?
Mm.
Things that aren't really boilerplate, because I interview a lot of people,
Mhm.
and to be honest, I like to keep it exciting too.
Yes. Of course.
So I like to ask a lot of different questions.
Yeah.
But most people ask the same types of questions. Now I'll ask one or two of those, and if I see that I'm getting the same boring answers, I'm turned off. I'll end the interview faster.
Yeah. That's a red flag.
Right.
That's red flag. Any other red flag?
The way you speak. So you have to change your tone.
Mm.
You have to not be monotone. The words you use. And one of the worst things you could do is lie.
Mm.
I once had someone put in their hobbies that they liked a certain band. And so I asked her, I said, oh, you like this band. What's your favorite song? Did you ever go see them? And it was no. And I was like, so why is it your favorite?
Yeah.
And she was like, oh, well, it was my boyfriend's favorite, and he thought it would be good if I put it there to make me look more diverse.
Yeah, that's not no. That's not
Right.
That shows that you are not capable of expressing yourself honestly. So that will create for yourself also a problem. So I think it is okay to be a natural.
Yes.
You know who you are. It's okay if you think that, oh, maybe I'm natural, this weakness I have, maybe program will not like me. That's okay. Program wants to see your strength and weakness so they can help you and they like you. If they obviously they want to see more strengths. So be yourself and be honest and be straightforward. And so that will and regarding the tone, Dr. Rizzo mentioned, a monotonous meaning like they ask you what is your name? My name is this. Okay, no, you have to continue and you have to continue your statement with a different excitements and then go back, seat and then again, stop. Like those type of actions will make you look like you are really interested and you are a genuine person. And we understand that interview is interview, but it is not end of the world. Trust me. The more you be excited and composed and honest, and that you really want to get into the residency program, we understand. We have interviewed so many people, so it's easy to pick candidate.
Right. What you don't want is I ask you a question and you give me 2 or 3 word answer. And then I ask you a question, you give me 2 or 3 word answer. The best interviews are a conversation between us.
Conversation. That's a very important word. Conversation. Have a conversation, and that will make you more successful. Dr. Rizzo, you want to give a closing statement for our interview so the students and residents can benefit?
Yes. So every program gets a lot of applications. For our 22 spots, we received over 6,000 applications in the first week alone.
Wow.
So programs are inundated. Inevitably, people are going to have high scores. People are going to have good grades. People are going to have strong LORs. What sets you apart is you. And what I want to know as someone who's selecting residents is 1, you're passionate about taking care of patients, and 2, you have humanism and empathy. Humanism in medicine is really something that is becoming less and less, because we are spending more time on the computer,
Right.
we're spending more time checking boxes, and less time getting to know our patients.
Right.
I want people that show they're humanistic, they're empathetic, that have those qualities that put patients at ease. Because I know that if you care about your patients, I don't have to micromanage you.
Correct.
I don't have to worry that if a patient's sick, you're gonna leave because the clock says it's time to go home. You're gonna be there because it's your patient, and you wanna make sure your patients do the best.
Correct.
So those types of qualities are the things that I wanna hear about.
Right.
And when you tell your story or you talk about your strengths, make sure you put some of those things in there.
Indeed. And I remember in my internship, one of the best thing it is now almost 15 years, but I remember still that one moment when I was intern, still completing work in CCU. One of my co-interns, she finished the work and she came to me and she said, "Do you need help?" That point I will never forget. I don't even remember her name now, but I remember how humanistic she was and how team leader she was. Those qualities, as many as you can have, that not only residency is easy, it is after the residency you have to face the world. And whoever you are, you will be. So, for example, one person asked me a question, is money make person better? No, money magnify you. Money magnify the person. So your character, your honesty, and your hard work will magnify you more in the residency program. So thank you, Dr. Rizzo. Thank you so much. I think from these all the points is going to help a lot of people, and we are looking forward and refer to your program also a lot of people, so they can also we can also get the good candidate and keep running this program as fast as we can.
Thank you for the opportunity to speak to everyone in the audience.
Thank you.
I appreciate it.
Thank you.
Thank you.